In bipolar disorder, people do experience elevated moods or hypomania, and it's important to talk about what this is like and why, in some cases, it's hard to give up. Sometimes hypomania makes people feel irritable or agitated, but oftentimes people feel elated. Who would want to stop feeling that way? Oftentimes people with bipolar disorder, when they're hypomanic, will say, "This is the real me." And they kind of think of when they're in a euthymic state or a state of sort of within their normal range of wellness as being depressed. You can see how that might be confusing. After all, if you feel at your best, you'd like to believe that that's how you usually are if you're not feeling low. It's not wrong to object to talking about something as a mental illness. That is pathologizing part of a person. It's to say that needs to be treated, that needs to be gotten rid of. And people understandably have a problem with that. There are three major dangers involved with hypomania. One is that hypomania is usually followed by a crash into depression, about 70% of the time. Second of all, this creates more instability. The third and most dangerous consequence of staying in that hypomanic state or trying to achieve it is crossing the line from that hypomanic, feel-good, productive state into the state of mania, where it becomes destructive and you're really not thinking straight and may do things that afterwards you regret. That also will change your diagnosis from a diagnosis of bipolar 2 to a diagnosis of bipolar 1. And basically, what that means is that once your mood has gone that far in the direction of elevation, it's easy for it to go that far again. So if you're like most with bipolar disorder and you struggle with the idea of giving up the times that you feel your best, it's a good thing to talk to your therapist about and see how you feel.